BioBalance Healthcast, Episode 88, Truths About Nursing Homes and Aging.
BioBalance Healthcast features conversations about positive aging, covering treatment and solutions that include bioidentical hormone pellet therapy, safe and affordable skin rejuvenation, and spa-quality botanical skincare. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
We are the sandwich generation. We have parents who are older than us, and we're starting to see it over the hill ourselves. Or maybe we look back and see the hill behind us. But we have children, and we're in the middle. And especially when we think about, as we get older, what do we do? How do we take care of our aging parents? What are the questions about levels of care for them as they get too old to live independently? The cost of that, the medical issues involved in that, the decision-making processes involved, the resistance, the fear, the anger. Oh my God, it's crazy.
And no one wants to talk about this.
Nobody wants to talk about it.
I used to not want to talk about it, but I'm on my third parent in a nursing home.
Yes.
Over a course of 17 years, constantly having somebody in a nursing home. So just because I'm a physician, just because I'm a mother, doesn't mean I'm not also the caretaker of my parents and my husband's parents.
And your own household, and your husband, and your daughter, and your dogs, and your business. And, it happens in the midst of life.
And it does. And it's right about the time we feel like our kids are in college, we've got some freedom, and then boom, there go your parents. And they may even be living with you. My patients tell me this every day.
And they go kicking and screaming. I don't like that person. Don't send that person to my house to clean for me.
That's right.
But it needs to be done. Why don't you do it? Why don't you come over and fix my dinner?
That was your experience.
That was my experience.
And so sometimes you have to listen to their requests.
Yeah.
If they're in their right mind, and sometimes you have to look at yourself and say, is this healthy for me? Now, let me just start with the first part of this is about how you need to be healthy so you are not a burden on your children, because we should look forward and see ourselves in that place. And every time I take care of my dad or do something for him, I think, how would I like it if my daughter did blank?
Right.
Or would that be acceptable to me? I put myself in his position.
It's a two-sided coin.
But I don't want to be in that position.
No.
And one of my big goals in replacing hormones, dealing with nutrition, helping people with Take Shape for Life get as thin as they can possibly, be to be healthy.
Right.
That's my goal is to get people so healthy that they don't need to be in a nursing home, have enough blood flow to their brain that we don't have to be there. But in all things, we should plan for the worst and hope for the best.
Right.
And so
failure to plan is to plan for failure.
That's right.
Right.
And I remember hearing from my parents that every time I wanted to talk about this, that they wanted to talk about finances, where all their money was, that was fine. But they did not want to talk about nursing homes, nursing at home, whether they would let somebody in the house to cook for them, which they wouldn't, whether they would they didn't need Meals on Wheels, but that was the only way you could get meals to them in another city. They refused to move here. We should have discussed all this ahead of time. We should have discussed things like, when you're in a nursing home, do you want to have your hair done every week? That's part of your choice, but you may not be able to make that choice. Are you concerned about your looks? Do you care about what you wear? Or are you going to be fine in a jumpsuit? Are you going to be fine in almost anything? Because there are some people who don't feel like themselves unless they're dressed appropriately, coiffed, have their nails done. And if that's the only thing they have, they should have that.
There's a certain generation of women out there, elderly women, who never
Not
appeared in public with a hair out of place. And wouldn't know a polyester if one bit them. And then to put them in a nursing home and give them polyester jumpsuits or sweatsuits and not have their hair done is so horrible. And not even in a nursing home. In your home. You've had the experience of having your elderly and ill parents live in your house. We've had the experience of having elderly and ill parents live
for a short period of time. They did not live in our house for long periods of time, and I'm not sure that that's healthy for relationships. But
it's a challenge
within the family. But one of my mother-in-law lived with us for 7 years, and that was delightful. She was delightful.
It's one of the few times I've heard someone say my mother-in-law is
Oh,
delightful.
I love my mother-in-law.
Typically, they say other things.
I know, but that's
Yeah.
not the case always. We can have favorite relatives that aren't related.
Oh,
to
absolutely,
us.
absolutely. But so the discussion is a two-sided discussion. One is from your perspective of saying, now that I'm dealing with this or have dealt with this for 3 of our parents, I don't want to be that person in my daughter's life. And certainly I don't want to be that person in my son's life. My wife and I have a son, 17 years old, and Phyllis says regularly, I don't want to be a burden on his wife, because she knows he isn't going to do it. And we don't even know this girl yet. She doesn't exist out there anywhere, but we're planning for her to take care of us unless we plan on our own to take care of us. And one of the ways to plan on your own to take care of yourself is to live a better life in terms of physical care, weight control, hormone replacement, so that you maximize your capacity to live right to the end, so that people don't have to take care of you.
Live on your own right to
Yes.
the end.
Yes, absolutely.
And that means you have to have muscles and bones, and that means you have to have testosterone. You can't keep your testosterone going, whether you're a male or a female, until you're 90. It just doesn't ever happen. And when it goes, your muscles go, and that's the first step toward a nursing home, because that means you can't get around your own house. Then you're on a walker, and then you're in a wheelchair. And I mean, it's really hard to go from walking and being healthy, but that's the last step. And I've had patients. I have an older man who comes to see me, and he gets testosterone. He's late 80s, but he couldn't recover from a hip operation. He couldn't get out of a wheelchair. Now he walks, he climbs ladders. I mean, with testosterone, he got his muscles back even at that age, and he's able to take care of himself, live on his own, with his wife, who also takes testosterone, and they have perfect posture, and they are taking life by the horns, and
you see a lot of these older
relieving
people
their children
that
of
it's
that.
not just their head. I mean, they're bent over from the waist, or their heads are down, and they're fragile. They have bad balance, and they can barely move. Go to the grocery store on Old People Wednesday, and they just drift through the aisles. They're completely unaware of anybody else.
Yeah.
They're focused on and they're trying to still be functional and active and out there, but they don't have the balance. They don't have the vision. They don't have the hearing, and they can't carry anything. They're not strong. You see them racing up and down the aisles in those carts, that electric carts.
And yeah, that's an adaptation.
Yeah.
But it is something that is preventable. I mean, not everyone has to be in that situation, but if we all live long enough and we don't replace the testosterone, if we don't exercise, you can replace testosterone and not exercise, not do things for yourself, not go up and down stairs, and then you won't be able to be mobile. Mobility is the biggest reason people go into assisted living or any kind of group living that has nurses associated with it. And the second is sight, loss of sight, because it's very hard to negotiate your house if you're blind. So, and my father has both.
Right.
So that's a terrible duo. But those are the things that you need to protect. You need to take vitamins for your eyes, but also you need to not have diabetes and be obese, because that's one of the leading causes of blindness. I mean, is diabetes, and not many people think of that. But high blood pressure is another cause of blindness because of retinal detachment. Macular degeneration, that has a lot to do with having smoked in the past, because lack of oxygen to your eyes is not good for you. So smoking is in general terrible for your eyes. And
I did not know that.
And it is somewhat genetic, but my dad had it at 50. He smoked till 50, and I don't have any sign of it at 57. So, I mean, he had it earlier than 50, actually.
Right.
But that's something that you can adjust things so that you can delay them beyond your death date.
Right. So exercise, diet, smoking, I mean, those are things we talk about all the time as quality of life issues.
Right, but every time you take a cigarette, you should think, I'm going to be in a nursing home. I mean, that's a horrible thought that should deter you, but maybe not. I have never been a smoker, so I don't know. The other thing that might deter you if you're motivated by money, and that I've been recently presented with this issue, is that nursing home care, and I mean aid care, not a nurse, not an LPN, but aides, private duty aides,
Right.
For your home costs $15,000 a month.
A month?
A month. $15,000 a month.
Is that a 24/7?
Yep, 24/7. But if you can't walk, you can't go to the bathroom, you can't turn yourself, that's what it costs.
Right.
And that's not even a nurse to give you your meds.
No.
So then you have to have nurses come in, and that's a higher cost. And so if you're in a nursing home, which is what we were in assisted living, and so my dad's there, and we're in assisted living, and that costs $5,700 a month. So that's a lot in itself. And then you go to, we have to add a private duty nurse to keep you here.
Right.
So
in order for, because the agency will say, we don't provide those services. In order for you to stay here and receive the services we do provide, you have to supplement what we do with additional care.
Right, because they don't qualify for assisted living if they have patients that might fall or might hurt themselves or need the rails up on their bed or need a commode or can't. I mean, all of these things, it depends on a full evaluation, but in general, if you can't take care of yourself, you can't take your own meds, you can't feed yourself.
So what are the levels? There's assisted living.
There's independent living.
Independent living.
That means somebody's providing all your food. You have an apartment or a room, and you are group eating. You're eating in a dining room with other people, and you have to be mobile. These places can have floors. You've always seen nursing homes that are skilled nursing has to be one floor because you have to be able to get out.
Yes.
You can't, the person has to be able to be pushed out or gotten out if they can't walk, and you can't do that with stairs. So if you have independent living or assisted living can be in a high rise, but skilled nursing has to be on one floor, and it has to be on the main floor so you can get out. So so that's one way of telling, but independent living has activities, and I mean, it's really not a bad way to go if you can't handle maintaining a house or you need somebody around, and you can have them wake you up in the morning and make sure that you're coming to breakfast and see if you're not there, checking on you. So it's kind of minimal care, and you're a little bit more independent, and there are qualifications for that.
So the global term nursing home could be independent living, assisted living, skilled care.
Yeah, and that's how it goes. I mean, it goes from independent, which is lower cost and less care by skilled people, to assisted living, which is more care. You can have some help to the bathroom. You can have some help getting to meals, making sure you eat. And it's just a little bit more. But if you have Alzheimer's or if you can't walk or move yourself at all, you have to be in skilled nursing.
My mother was a widow, lived on a farm out in the country by herself. She was depressed, she was diabetic, she had limited mobility, and we discovered that she was living in this big farmhouse, basically on a couch in the family room with a path to the kitchen stove, refrigerator, and a path to the bathroom, and rarely moved off the couch. So we moved her into a nursing home, and she was very grateful because even though she was in a wheelchair in the nursing home, there were people to talk to, there were cards to play, dominoes to play, TV to watch with others. I mean, she had a quality of life enhancement, and then in that nursing home could escalate into the skilled nursing care sequence when her body broke down further, and then she eventually died there. But the process of doing that required her agreement and participation. And we had to have some conversations with her to say, we don't want you to die alone in this farmhouse, and the way you're living we can't stand, and we need you to let us help you. And she was very resistant to that conversation.
If no one wants to leave their house, no one wants to go up a level in nursing, no one wants to have less privacy, and that's what all of this entails. So I don't know many people who really want to go, oh yeah, I'm out of here, I'm going to go to a nursing home. I mean,
her depression fell away. She was energized by being around people to interact with and talk to, that she didn't anticipate and really resisted on the front end. But she had a good experience on the back end.
And that's great. If you have the ability to be social and you want to be social, you still have that kind of part of your personality. And things do fall away as you get old. I guess the best way I can look at it is if you can run the race and you have a very short period of time where you can't take care of yourself, that's doable for you and your family. You don't lose your whole self-esteem in a slow fashion. And that's more related to being healthy your whole life and taking care of yourself, making yourself part of your priority list, because women care for everybody else, and then
Right.
they don't care for themselves. And that's just a common
Yes.
woman thing, because you're caring for your parents, you go to work, caring for your kids, you come home and you pass out. You don't exercise, you don't eat right, you sacrifice your own self
Right.
to take care of all of these other things when you should ask for help. And you should limit, I mean, no one needs to have their mother at their nursing home every day. And I keep telling my patients, you are giving yourself a burden you don't need, because that's not required. They're there to help and to take you. If you want to go, that's different. But if you find that you don't have any time for you, then you tell your mom or your dad, I can come on Tuesdays and Fridays.
Well, you
And-
have to remember the airline deal. You know,
Yeah,
if,
the
if
airline
the
deal.
oxygen mask drops down and you're traveling with small children, put it on you first. Because
That's
if
right.
you collapse, your children are going to die.
And those of you who have a parent taking care of another parent, it's more likely that the parent that is taking care of the sick parent will die first.
Right.
And you'll be taking care of the sick parent if that parent that's the caretaker doesn't get help. And they probably won't, in this generation that's now in that stage over 75 or 80, they probably won't ask.
Not only they won't ask, they'll resist.
That's true.
I want to do it. I've always taken care of her.
wanna
I've
do it
always taken
myself.
care of him. We've worked hard all our lives. We're strong people. We'll take care of it.
And there's other things. They don't want you to know that their spouse is incontinent, or their
Right.
spouse is angry sometimes, or they get confused. They don't want you to know that. So
Right.
you do have to be around enough to figure out what's going on and see if they really need help. They don't know they need help, and they're not going to admit it. So getting a social worker into your house from the nursing home you're looking at or from the assisted living you're looking at is part of their service, and they'll evaluate your parents and see if they really need care or not. If they don't, they aren't going to offer care. So it's not covered by Medicare. The only kind of nursing beds are Medicaid, which means that you don't have any money, and there's a look back. You can't just like give your money away and say, oh, I don't have any money. You can't do that. They look
Well,
back 5 years to see
a-
what you've given away.
There was a problem when Medicare began to really blossom as this generation got older, that people who had amassed some kind of an estate wanted to guarantee an inheritance for their children, and so they would give them the jewelry, give them the house, give them the bank account, and then say, well, I'm destitute, I'll take a Medicare bed.
Right.
So Medicare had to start going back and say, you're not destitute, you've shifted your assets to preserve them for your inheritors, and you have to use them for yourself.
Right.
And you do have to use
Because
them for
it's
yourself.
cheating to do that.
It
and
is.
They used to have a 3-year look back. Now they have a 5-year look
5-year
back.
look
So you can't. So if you get in a nursing home and you say that you have nothing, and they just look at your income taxes for that year, then you're going to end up with a full pay bed because they know that you aren't able to have a Medicare or Medicaid bed.
What
It's
about a
not good-
hospice decision?
That's a decision I've had to make a few times. Hospice doesn't necessarily mean that you have cancer and that you have a known death date, that you know that you're going to live 6 months, you know you're going to live 3 months. It means that you're not going to get better, and you have a short period of time until your death. It's not years usually, but they don't throw you off hospice if you live longer than 6 months.
But generally the thought is it's a 6-month window.
Yeah, that's usually what they're looking at. Less than a 6-month window, but people stay on it for longer than that. It means that you're not going to go to the emergency room again, and that you're not going to get resuscitated. You have to sign a DNR. As far as I know, you have to sign a do not resuscitate order, or your power of attorney, which is like me for my parents. Power of attorney has to sign the do not resuscitate order. In other words, do you want to be on a respirator?
Right.
That's one of the decisions.
So it's a conversation you have to have
You have
with
to
your
have with
elderly
your
parent.
parent.
Is this a treatment that you want in order to extend your life at all costs? Or is it a treatment that you don't want because you have to speak for them?
Right.
If they give you that power by signing the attorney,
That's
power of
right.
attorney.
So in any case, that's something. The other thing is your medications will then be covered by Medicare. So
But
if
the
you
process,
get on
the process of that, I'm not a nurse or a physician. I can't look at my grandmother and say, okay, you need to be on hospice. The doctor has to ask the hospice people to come in and do an assessment.
Or you can call hospice and have
You
them.
can yourself
You can call
call.
one of the many hospice organizations, and you can have them come in and assess your parent
Okay.
And then they'll tell you whether they qualify for hospice or not.
Okay.
And they have a medical director who will then qualify them for hospice.
Okay.
I mean,
So
my-
someone in a licensed role of authority has to make that determination.
In other words, you're not getting better and you're going downhill fast. And so it's very nice. They have music therapy, and they have pastoral care, and they have all kinds of really nice
You
things.
do a lot of touch,
that take care
physical
of your
touch,
parent.
especially in the latter stages of life, speaks volumes about your humanity and your love and your care and your reality, your existence. And as elements of your awareness and physicality begin to fall off, being touched and being talked to is a critical quality of life enhancer.
And if you can't hear,
Yeah.
it's going to be touch only.
Yeah.
And putting cream on your mom's hands.
Yes.
Or,
Rubbing her
something like
feet.
that. Yeah. That kind of stuff
Scratching
is
her
much,
head.
is
I
much
mean,
appreciated.
They do those things. Those people are saints. We ought to
Yeah. They are.
designate hospice workers and systems for sainthood. They are phenomenal people that help you at a time when you need a lot of help, because your own grief and loss issues come into play.
Yeah, and your own
And the
childhood
question,
disasters.
am I
and-
doing it
and
right? Am I
parental
doing the right
ideas
thing? Am
come
I
into
making the
play.
right decisions?
It's-
So it's
so-
a complex problem, and we're going to have additional conversations about it, because we want to talk specifically about things like medical directives and a will and a power
things
of
that we
attorney.
can do to prevent. I mean, if you're very young, your parents can do, but
Right.
if they're
Well,
not
and-
already in that situation,
And they
but
want
if
to do
you're-
it for your own children.
and you want to do this for your children.
Yeah.
This is just as important as putting money in the bank for them. It is making them not have to grieve you and have to also worry about what do you want and all the care and all. It's exhausting. I mean, I can tell you it's exhausting.
So thanks for listening today, and come back for our next conversation.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. Follow Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Brett Newcomb can be found at brettnewcomb.com.